So, going forward, Dr. Mulasari, what would you advise people to do to be extra mindful of at on this World Heart Day this year, 2021? With all the learnings we have from the last 1.5 years, what should people be doing? How much of extra care or the same amount of care should people be taking? And I think my next question would also be related. When do people really need to start doing precautionary stuff like doing tests on themselves and checking their blood pressure, etc.? At what age should that begin?
So this is a larger question as to how do you prevent vascular disease. So the prevention of vascular disease happens as early as you can. And when I mean as early as you can is if you have a family history of diabetes or hypertension or heart disease, then maybe by the age of 20 or 25, you should be checking your blood sugar, your blood pressure, your cholesterol, and many of the other things. If you do not have a family history of heart disease, then you can afford to be a little bit more later in your life, maybe by the age of 30 or 35. And if the numbers are okay, your blood pressures are okay, your sugars are okay, your cholesterols, maybe repeat it once in 5 years. But if this is abnormal or is borderline abnormal, like you see in diabetic patients, you get something called as impaired glucose tolerance, where the sugar is not diabetic range, but say in the 100 to 110 range of fasting sugar, then you need to do it more regularly, maybe once in a year or something like that, especially if you have a family history of diabetes. So technically what you need is a close watch on your risk factors, which are not modifiable, which you have inherited, maybe from your parents in certain ways. So this is something we need to be very, very careful about.
Dr. Mulasari, if people who were planning or have been identified to go in for interventions like angioplasty or even for that matter bypass surgery, and they have happened to be COVID patients, what is the basic general advice to be given to people like this? What is the amount of time that they need to wait, and the precautions they need to take?
So, in general, when there is an active COVID infection, we do not intervene in terms of doing an angioplasty or surgery because, like any other infection, doing a procedure when patient is infected will increase the complication rates. So, we normally wait for about a month after the COVID infection settles down, and patients are comfortable. If you have to do this in an urgent manner, for example, if a patient has severe blocks in the arteries and he was scheduled for a bypass surgery and he developed COVID in the interim, then you would wait for about a month before you do that. If there is an elective procedure, that means that say an appendix or something like that, which doesn't need to be going in very quickly, we would wait for 90 days so that things settle down completely. The body's inflammatory status is back to status quo before we do the surgery of that form. But if there's an absolute emergency, like for example, if somebody's got a heart attack or something like that, then we wouldn't wait. We would go in with the active infection and do an angioplasty with taking precautions both to the health personnel and the people in the lab so that nobody gets cross-infected during this procedure.
हेल्थ फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।